Hi, everyone. So this week, week 11, we're looking at aging on the sensory systems. And so for our lecture this week, it's going to be an article that I came across a couple of years ago. And I think it's a really good article, really comprehensive as far as what we know and understand about aging on sight, on hearing, on, smell and taste and some of the other sensory perceptions. And so I kind of want to set the context for this article. This was written by a public health specialist. And so you'll find a lot of this type of information in that forum where we're educating the public, we're educating as a part of, preventative care, we're educating families and caregivers about what they should be mindful of, about what they should be sensitive to as far as aging individuals and how their sensory perception is changing. And so that's where I found this article. And so I just wanted to go through it and kind of highlight some of the important parts of the article. Before I do so, I just want to remind ourselves that we talked about the reason for some of these changes. And so we're not going to get into the biochemical mechanisms that underscore these changes, because we said that things like slowing down of the conduction velocity of neurons, we said that loss of some of the pyramidal neurons, we said there was also a decrease in the neurotransmitters and the receptor sensitivity, which play an important role in signaling in the peripheral and central nervous system. And so those types of biochemical changes are what results in the decrease or the dysfunction with the aging, the sensory system that we're going to speak about as a part of aging here. So we know that most older individuals cannot see, hear, or smell, but have lost their ability to see, to hear, to feel, to taste, to smell the way that they once did. And so the normal aging process really gradually and steadily declines in the function of our ability to appreciate the world around us. When we start out by looking at vision, vision slowly degenerates beginning around age 50s. I'm sure if you've got grandparents in your family, even parents maybe, you can appreciate that they have to wear glasses. The lens becomes less elastic, right? There's a loss of elasticity widespread throughout the body. We see this with elastic arteries. We see this with tendons and ligaments, and we certainly see it here as a part of the lens of the eye. And so that can slow down the ability to perceive near objects or far objects, or just to accommodate, to perceive different depths or different distances. We also see scanning becoming a little bit difficult. So the ability to visually scan an area, to perceive, to process that information, it takes just a little bit more time. So older individuals may be slower at doing tasks that they could want to do, with much more vigor and precision. They may have to pay a little bit more detail to it, be a little bit slower, be a little bit more careful and mindful. Things like driving will be impacted by this. And so there's that slowing down of not just the physical system, but of the ability to perceive what's happening. And so there's a slowing down in the effect as well. The pupils get smaller. The lens also gets thicker. This is in the absence of some of the disease that I'll point out a little bit later on. These are some of the normal changes. So we see that the lens gets a little bit thicker, a little bit less transparent and more opaque. And so that ability for light to get to the retina is a little bit harder. This may give older individuals a bit of a hazy vision, again, in the absence of things like cataracts, which I'll talk about in a bit. There's still this haziness to the vision sometimes, making things appear more shadowed, and being harder to discern between things like colors the way we once could in our young adulthood. That begins to happen at around 60, 65 or so. Near vision on a whole tends to decline, even when we think about, individuals who have to wear glasses. They may need specific glasses for reading, things that have to be appreciated from close distance, like reading, like sewing, knitting, cooking even. There needs to be glasses in order to appreciate some of those near vision views. And then the article goes into some of the actual disease processes and pathology that are a part of aging, right? Aging individuals are at a higher risk for these types of diseases, but they're not always seen And so like we've been doing with other systems, we want to delineate normal physiologic changes like thickening of the lens, like loss of elasticity, et cetera, from actual disease process, right? Which is like cataracts. We can see things like macular degeneration. We can see diabetic retinopathy, which is that glycosylation of the small arteries that feed the retina. We can see hemorrhage to those arteries, giving impaired vision. This is often seen in diabetics who have high glucose levels in the blood, which can cause that kind of damage to these small vessels. And so these are some of the actual disease process that older individuals are at higher risk of having, but are different from some of the normal, gradual, sustained changes that we mentioned about. And then the article even suggests some of the important helpful tips and tricks and supplementation that can reverse or improve some of this vision change. So a good diet that keeps vitamin A high, vitamin C high. We know that vitamin C is important for all connective tissue, certainly the lens, the health of the lens. Vitamin A in general is good for, eyes. That's found in your dark leafy vegetables and so on. And then we also know vitamin E, which is an antioxidant, will help prevent some of that RRS damage that could potentially lead to some of the visual disturbances. As far as hearing, we see a lot of different changes involved in the slowing down of the hearing. First of all, some of the muscles in the inner ear actually atrophy. Some of the bones, like the ossicles, the three important ears that help to pass that vibration from the external ear into the inner ear, into the labyrinth and so on. Some of those bones also ossify as a part of the general ossification of the skeletal system. And so those changes, although widespread, have a more focused change in the hearing and can result in hearing loss or hearing change. And so again, this happens gradually with time. We can also see that degeneration of the nerves of the ear. So the cranial nerve 7 and 8, which are the facial and vestibulocochlear nerve. And so there can be disturbances with balance as well as a part of that nerve dysfunction. Now, other things can cause hearing loss, especially other lifestyle factors. So if you worked in a really noisy, loud environment, like if you were a construction worker and you had to listen to that jackhammer every day, or if you worked, in sound, and if you were a sound engineer and you had to listen to, high volumes of sound, if you were a DJ, I would imagine, during your life, if you had injury, so actual blows to the head or the ear can also result in long-term permanent dysfunction to hearing as well. There are some medications that have side effects, certain antibiotics, other disease processes like strokes, depending on what nerves they injure. Again, diabetes, which can injure some of those tiny blood vessels, ear infections, there are hereditary causes. So there are a bunch of other causes that can lead to hearing dysfunction that could also allow or explain why elderly individuals may present with hearing loss as well, or maybe at a higher risk to some of the hearing loss. Older people, so this article interestingly gives a little bit of a social commentary, I guess, on why older people tend to not want to have hearing aids. It's kind of that, that stamp, that seal on aging, really, where you need a hearing aid. Your hearing has gotten so bad that you need an aid. So it's a symbol of old age. And so you may have some older individuals being, very resistant to stamping that seal on their aging and to coming into acceptance that they need this in order to appreciate the world the way they once could. I'm going to skip over here to the sense of touch. This one really has to do with, that nerve conduction velocity, the loss of myelination of nerves. And so we want to be mindful, especially of this sense of touch. So because there's a loss in the ability to perceive touch, older individuals may have pressure wounds, so bed sores or, decompression wounds. There may be just general malaise or joint pain or just feeling of unwellness that older individuals may not be as sensitive to. They may hold hot objects or sharp objects. And so those are the types of things that we really want to be mindful of with this poor sense of touch. And we can also see this as a part of some of the other disorders that we talked about. Parkinson's disorders, arthritis, strokes can also have an influence on the body's ability to perceive touch. And so the article also talks about some things that caregivers can be mindful of and can do to overcome this loss of touch. The last sensory section here in this article are taste and smell, which are kind of, addressed together. This is usually changed. The changes that we see are less saliva, so a lack of an appreciation for discerning different tastes, a decrease in the number of taste buds, a decrease in the size of the taste buds as well. So again, an inability to perceive the difference between, salt and sweet and umami and bitter the way that we once could. Also, this poor dentition, which may be a part of the psychological aspect of frailty, where we, stop caring for our oral hygiene and, self-care in general, which also ties into that decreased saliva. So saliva is what helps to keep, the bacteria in the mouth controlled. There's lysozymes and antimicrobial properties of saliva. And so when saliva quantities decrease, or the properties of saliva decrease, if it becomes less watery and more viscous, that can also result or compound that poor dentition that we see and lead to overall more serious diseases of the mouth. And we also want to be mindful of other lifestyle, risk factors that these individuals may have partaken in as a part of, their early life. So smoking, drinking, chewing tobacco, those types of things will only compound further some of the normal sensory changes that are perceived as a part of taste and a part of oral perception. All right, and so you can also have a look at some of the references here if you'd like to, read on further about some of these changes and some of the work that's being done in the public health space around awareness and education, especially for caregivers and preventative healthcare specialists, in terms of being sensitive to these types of changes. That's really the audience for this type of work and for this type of study. Is really just getting the message out there that if you're caring for older individuals, 60 and above, you really have to be mindful of some of these types of changes. And so this week, I thought it would be fitting, since we've already talked about the biochemical mechanisms that underscore these changes, and since aging is really something that is, happening to all of us, none of us are exempt from this process, which is one of the fascinating aspects of aging. I thought it would be a great opportunity for you all to reflect on aging from a structural and functional perspective, from a physical and mental perspective. Think about some of the things that you would look forward to as you age, as well as things that you would not look forward to as you age. And think about some of the underpinning mechanisms that would support either of these types of changes. I know for me personally, I'm not looking forward to the gray hair, which I've already started to get, especially in the crown here of my head. I'm not looking forward to the visual changes, which have been a little bit more apparent in the last couple of years. I am looking forward to maturity. I am looking forward to, that more counseling role in society, giving back to society. I'm looking forward to eventually rearing children and seeing them grow up in the future. And so there are aspects of aging that I am looking forward to. I'm not looking forward to the wear and tear theory type changes. So on joints, on ligaments, on the heart. I'm also not looking forward to the immune system dysfunction. So the fact that you're more likely to need your vaccines as you get older, to keep your body from getting sick, because it's so much harder to combat diseases and to remain in general health as you get older. I am looking forward to some of the changes of the brain where we know that older individuals get better at reasoning, get better at making certain decisions that affect their long-term well-being, and just becoming more wise, if you will. I am looking forward to some of those types of changes. So I encourage you to, again, reflect on some of your own experiences, and some of the theories and mechanisms that we mentioned, and think about which ones you will look forward to, you won't look forward to. Also reflect on the type of individual that you might be at age 60 or 65. Alrighty, and I look forward to those reflections.